Welcome to the Codecast Podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast Podcast. My name is Terry Fletcher. It's great to have you here this week. We are excited as we keep expanding our listeners, and we're over 35,000 listeners as of this week. So pretty excited about that. Just a reminder to everybody, if you wouldn't mind rating us on whatever platform you listen to, whether it be iTunes or on YouTube, Stitcher podcasts, or if you are listening on TuneIn, Spotify, any place. So if you do that, we would really appreciate a rating and also a review. So thank you for that. Also, shout out to my listeners who have been emailing me, commenting on the podcast. Very positive. I love it. And we're always happy to bring your topics that you've asked for. So a couple of listeners have said, hey, can you talk about certain topics? And so a couple of things today I am going to mention that have been brought to my attention. And one of the things that comes up quite a bit, and I've actually been kind of promising you that I'm going to talk about this subject, would be remote coders and trying to work from home and finding those jobs that are a little bit more convenient than having to deal with a commute. But first, I want to really talk about, is it for you? And what they're saying out there just from working from home in general. And so we want to really kind of visit that. But first, we want to thank AID, Association of Independent Doctors, all doctors, medical doctors, doctors of osteopathy, dentists, and podiatrists who do not want to be acquired by a hospital or private equity group, or who want to break free of employment, should join AID, as should any health advocate who believes in supporting independent doctors, as I do. So check them out at www.aid-us.org. And Movado Watch Company, one of the world's leading watchmakers, Movado, modern ahead of its time, movado.com. So let's talk about remote coders. But first, let's really kind of explain where this came from and kind of the history behind it. So I was reading an article recently in a magazine called Inc. Okay, so Inc.com. And they were talking about open plan offices. And they said this is just such a great thing. And that, workers can, now interact with each other and everybody can see what everybody else is doing and you don't really need privacy. Well, I don't buy it. Okay. For me, now I like some background noise when I'm working, except when I'm auditing and I'm reading medical records, for example, I actually need to focus. I need some silence. I need not in the interruptions. And so it's hard sometimes when you have people asking you for things or the phone's ringing, patients walking through, doctors walking through, other employees walking through, and trying to focus on what you're doing. So when you have this open concept, if you will, where everybody has a desk in the same area, that can be pretty tough. But when I look at these open plan offices, let's just take it out of healthcare. I think they have it at Google and some of the different big corporations. And so I know that there have been a couple of studies being done, and let's just take a look on what that evidence has shown. So Stanford University did a study of 47,264 workers, and they found that they are happier and more productive if they have actually a private office. But the study just assumed that everybody would be coming into work every day. And so I was asking the question, well, what about working from home? Well, first you have to ask, before we go any further, what makes a management strategy smart? And this is really what this is. So the best definition of a SMART in this context is an easily implemented strategy that increases revenue and reduces costs. So a quick but permanent productivity boost, in other words. But few management strategies really meet that criteria. You hear about companies downsizing, for example, which can reduce costs but can kill revenue. Centralizing and decentralizing are not only time consuming, but kind of a wash at some point. And we've heard about reorganizing. That's definitely time consuming and sometimes pointless. But let's talk about the management strategy of letting employees or allowing employees to work from home and remotely rather than forcing them to come into the office every day. And can this provide, huge financial benefits or cost-saving benefits to the organization that's allowing it? So first of all, does it raise employee productivity? Well, it can raise productivity if the people working from home are disciplined and understand what it means to actually, quote unquote, work from home. Now, in this Stanford University study, it showed that employees that worked from home 3 to 4 days a week were 33% more likely to feel engaged and 15% less likely to feel not engaged than employees that had to report to the office every day. Now, one of the big results or things that came out of this study was that it did reduce attrition rates. And what that means is turnover. So the cost of employee turnover is huge, far larger than most people, even managers, assume, especially in healthcare. So depending upon the study, recruiting, hiring, and training and replacement after an employee departs, it could cost you up to 2 full years of that employee's salary, assuming, of course, you can find a qualified candidate. And that is difficult in a hot economy and where it seems like employers want experienced coders, certified or not, instead of that new coder that is looking for a job, which I find kind of, it's almost counterproductive. How can you get experience if you don't, allow somebody to have a job? Look to see if that person's trainable first. If the person is trainable, we call it coachable as well, and they can learn pretty quickly, then, regardless of what experience they have, if they, sat through and got their certification, shoot, I would give that person a chance for sure. In addition to lowering your attrition rate, a work-from-home policy could make it easier to recruit new employees. It seems like new employees, that one of the first things they ask, will there be an opportunity for me to be able to work remotely? It's almost like the new millennial question when they're interviewing for a job. And so that can be something that you offer down the road. Or if you're, I see a lot of ads right now for remote coders, but I also have some feelings on that. So when I really kind of talk through this with you, see if you're ready and everything, you'll see kind of where I'm headed to that as well. Now, probably one of the most glaring positives for allowing somebody to work from home would be that it results in fewer sick days. So according to the Bureau of Labor and Statistics, around 2.8 million workdays are lost each year due to absenteeism. So for some companies, this is almost $1 million loss each and every day. And when employees work from home, they're more likely to do so when they're sick because they're saved the stress of commuting and interacting with other employees. And just as important, while they're working from home, they're not spreading their illness and germs to their coworkers, which is a huge problem, especially in these open plan offices or a tight fitting office where you've got, your whole billing or coding practice and central billing office maybe in one small room. And as healthcare professionals and in a medical practice, do we really want somebody sick coming into patients who already have a lower resistance? And I don't know about you, but this is what happens to me when and if I get sick, which luckily for me isn't too often, except 2018 was not a good year, a couple of times. But when I'm sick, and now that I have my satellite office and I actually do leave my home to go to my own office at work, it's interesting because I'm bummed. I'm like, oh, I got to get up and get to work. And so, but when it was in my home, I was pretty excited to be able to just walk across because I knew there were deadlines I had to get to. And so when employees have that opportunity to meet those deadlines without having to get dressed and, kind of look like they want to come in carrying their box of tissues, at least they're getting some work done and they're probably just happier not to be spreading things around. They feel more productive and they can, work in spurts. They get 2 hours done, go lay down for a while, and then come back and try to get some more things done. And I'm not saying that people who are sick that, work from home or remotely can't take that time off and actually be sick. But at least there's an opportunity there if they're working from remote access, that if there is a deadline or there's an emergent situation, it's not waiting till the next day or it's not waiting till that person recovers. Usually they can lift their head off the pillow and go take care of it. And they want to. They don't want things to back up on them as well. And so when they have the time, a lot of employees who are remote will take care of things much more efficiently when they don't have to deal with coming in the office sick. So a question comes up as far as, does it reduce payroll costs? Well, payroll is one of the largest expenses for most small businesses, and it's almost 30% of the company's gross revenue, and much more if it's a startup company where they're not really getting much revenue yet. So fortunately, the average worker will, and this is one of the studies, said that they will take almost an 8% cut in pay when they're allowed to work from home. And that makes perfect sense when you consider that working from home reduces or even eliminates many hours per week spent commuting, and that time can be spent doing other things. So assuming that you have a 30% payroll cost and a net margin of 3%, an 8% reduction in payroll comes out to about a 3% increase in net margin. And that could effectively double your profitability. And remember, that's not counting the 13% higher productivity and other cost reductions, such as office equipment, chairs, computers, the certain things that you have to buy for each employee, space. And so just that alone, you could see that there's some profit margin availability there when you have somebody that works remotely. So now let's look at this from a healthcare perspective. So I remember reading an article a long time ago, I think it was around 2001, that described how Health Information Management Department had successfully implemented a remote coding program, and it resulted in boosted retention, increased morale, and improved overall performance of that department. Now, even though 2001 wasn't that long ago, it really feels like it's been much longer since the days when many coding professionals were working out of the basement of some hospital, still coding from paper charts, and the idea of being able to work from home was really much more of a dream rather than a reality. So now we fast forward to today, and it is an expectation that coders be allowed to work from home, whether it be from day one or after a brief training period. And I've noticed that coders want the guarantee that at some point they will be allowed to telecommute. Many people enter the industry with the main objective of someday being able to work from home. Now, there's no denying that remote work has been a major factor in job satisfaction, as I mentioned, but it's not all about the coders. There was a lot of benefit for the employers as well. And also, a lot of the employers now feel that the coders can be more productive if they can work from home. One of the big things it did was it opened the candidate pool for these employers with the ability to hire in different states. So, for example, a coder could live in Ohio but work for an employer that's in California without having to relocate. And employers would no longer have to pay for contract coders to come and work on site. So it was ideal for both parties. There's other industries where telecommuting came long before healthcare. And I know some of those industries are actually starting to call employees back into the office. I read recently that in March 2017, IBM announced that thousands of employees would have to return to the office. They had been allowed to work from home for over 30 years. Yahoo's one, Aetna, Bank of America, Best Buy have canceled or revised their policies. They've had many reasons and opinions on why these companies chose to bring their employees back into the office, but for them, they said it really didn't work for the business needs of the employer. But as far as coders still being more productive when they work from home, in my opinion, that's debatable. For one, there are so many more distractions than there once were. You've got social media, Netflix. You've got some people that have now chosen to homeschool their kids, and not that there's anything wrong with that, but if you have a job to do, you're going to have that time carved out where you're doing only your job and focused on what your employer expectations are. Yes, there are many coders that are dedicated and fully meeting the productivity requirements. However, there are some that are not. Some appear to be, but when you really look at the data, there are large gaps of unaccounted time. And our employees still engaged. So one could argue that a trade-off of working remote was employee engagement. Do you remember the days when you could just lean back in your chair and ask your coworker a question? So yes, we have Skype and we have FaceTime and email, but many coworkers don't know each other or have never met. So remember when you and a group of your coworkers used to go to lunch together? I used to celebrate baby showers, weddings, birthdays in the office, and you were really connected to your coworkers. But now times have changed. Also, are coders still climbing that, I don't want to call it a corporate ladder, but the job ladder? I mean, career advancement may be impacted for telecommuters. If a promotion requires a coder to come back into the office, they may not be interested. And for those that would be willing to return to the office for a promotion, they may but not even be on the boss's radar because the boss doesn't know how they interact with other employees and how they work independently. So there was a study cited by the New York Times that found employees who worked from home are half as likely to be promoted. The workers in the study were considered to be happier overall, but 50% eventually asked to return to the office, citing loneliness, lack of engagement, and lack of career advancement. So working as a remote coder, it can actually give you some job satisfaction, and it also can give you that maybe autonomy or just that quiet space you need, as long as you have a dedicated workspace. And that's something I just wanted to kind of talk to you about. What is it that you need to make it work for you to be a remote coder? And this is what will be really attractive to an employer that you're trying to say, I want to work from home. So the first thing is that you have to say, I have a dedicated office space. Not that I'm at my kitchen table in my house or in my small area. You have to have a dedicated office space. It doesn't have to be a quiet room per se, but it has to be an area that you have in your home that will be not only protected, HIPAA protected, so nobody can access anything that you have that has patient information. And if you're accessing your system remotely, that you also have a computer that is password protected. But also you want to make sure that because of those defined spaces, I would also take a photograph of it so you can show your potential employer that you know where your focus is and that you have that dedicated area to yourself and it's just for working. I would recommend to any employer, I know some of you are on the call, that you try this first with experienced coders. I don't know that I would try it with a new coder. I think they need to still have that on-the-job training and experience and really get to know their fellow coworkers. That way, there's no jealousies, there's no issues, and when they're trying to get information from somebody, the person that actually is commuting to work can buy into that person. They actually like that person and want to help them. Because let's face it, coders and billers and healthcare professionals, if you're working remotely, you are going to need some information and access to your employer and to the practice. So you will have it from digital and electronic means, but you need to still have some kind of a liaison person, whether it be the administrator or a coder or a biller or somebody in the billing office, or even at the front desk, maybe one of the mid-levels, but that knows you personally, that knows what you look like when you come in, and they don't think that you're just dropping off paperwork and then leaving again. And, there are some issues there with people not thinking that maybe you're doing as much work as they are. So I think it's important that the new employees, they make those connections and they build a reputation, if you will, so that when they do ask or expect, or at the time comes where you do want to offer them the position of remote coder, that everybody knows who that is, and that they have a buy-in to the practice from a personal standpoint, kind of like putting a face to a name. This week I was, or I should say a name to a face. This week I was in California. I was all over Pasadena and Los Angeles and Anaheim and San Diego giving live coding seminars on gastro and cardio and orthopedics, etc. And I noticed that a lot of people were like, oh, Terry, I'm so happy to meet you. I had a lot of return people, but a lot of new people, which is always good for business. And some people were like, oh, I've heard your podcast and, I was really wanting to meet you. And I got just this really nice compliment from these two gentlemen that were sitting in the back of the class. And one of them said, I've been listening to your podcast for a year and haven't really had a chance to meet you. And now that I've attended your full day class, I like you even more. And I just thought that was such a great compliment. He said, you took the time with us, you answered our questions. He goes, oh, and by the way, you're kind of funny. I'm like, no, I'm super funny. But it was just funny because we were having this conversation. And yes, I try to be a little bit of a comedian, but you have to get my sense of humor. But it was just kind of a really nice compliment because it reminded me that you're listening to me. You're not necessarily seeing me, which, by the way, we are going to try and change a little bit and maybe do some videos for YouTube. But you really want to, have some of that personal connection. And then when you have somebody remotely, like what you're doing with my podcast, you can connect with that person as well. Now, if you need to see my picture, it's on my website. You can also follow me on Instagram, but at Terry and CA. But, and actually now we're on Facebook. I forgot to tell you. So find Terry Fletcher Consulting on Facebook and you'll see what we're doing there. But there are some things that I think, you really have to keep in mind, not just that personal space. Make sure you've got a good computer. And I would strongly recommend you get a desktop. You can have a laptop if you feel that it's one of the brand new ones out there with the fast processors, and it's approved by your employer that it can work for remote access. But a desktop also can be very helpful. You can't just work off of tablets and your phone. You have to make sure that you've got a computer. But you also want to not get into the trap, I guess, of getting up in the morning and basically putting on your slippers, pulling your hair up in a bun, grabbing some coffee, forgetting to brush your teeth, walking across your living room to your office, or heaven forbid your office is in your bedroom, and basically saying, oh, wait, and then you empty the dishwasher, and then you go and put in a load of laundry, and then you do, and then all of a sudden you're doing all these things, and then you're checking your social media, and you look at the clock, and you're thinking, oh my gosh, it's already 11 o'clock. That's a problem. If you are going to work remotely or from home, okay, then you really need to treat it as a job that you just don't have to commute to. So get up, get dressed, take your shower, get your coffee going, and then turn on everything in your office, and then grab your coffee just like you were going to be, at your office, and then start to work on time. A lot of companies are watching when you log in. And so they are looking to see what hours you put in, which I'm looking more for productivity, but they are looking for that. Now, it's not that you can't be flexible at home, but you need to make sure that you've got that quiet time, that space. That's the one reason why I had to move my office out of my home. I have a daughter, as most of you know, I've talked about her before, and she's an adult daughter finishing her master's in credential program before she's a high school teacher next fall. Wow, it's in the fall. I just thought of that. But she would come into my home office all the time and say, oh, Mom, I want to tell you something. And it was very distracting. Now, because I'm disciplined and I get my work done and I work 12-hour days, that was one thing. But when I get to now leave and actually come to my office space that I ended up leasing, it's just so different because I can close myself off. I don't have workers anywhere. I have my own dedicated space. And that's, typically what you need to be able to make it work. And so just keep those things in mind if you're considering a remote position. And if you're somebody that needs to have, people around you, or you get lonely at all, or you're already cut off from friends, you might want to reconsider. A lot of people really need that interaction. They need the social aspect of it. That's one thing about sending our kids to school, early preschool, whatever. It's so they can get used to being socially active, that they know how to respond to different situations that happen. And so even though it is a wonderful thing that they're allowing, coders and billers and, healthcare professionals now to work remotely, is it for you? Think about those things before you move into that sector, because once you get there, it's sometimes hard to come out of it. So we'd also like to thank Keck Medicine of USC, 500 international renowned physicians, and a leading academic and medical center, keeping you healthy, on track, and doing what you love to do. The Keck Effect, keckmedicine.org. So my coding question today is kind of interesting. So we've had some new 2019 codes, and we want to make sure that you are up to date. And I have a telehealth, telemedicine, virtual visit, e-visit, whatever you want to call it, webinar coming up on January 29th, which would be a week from the time you're listening to this webinar, because this one is going to drop on the 22nd. And so I strongly urge you to attend it and you can register on my website at terryfletcher.net, because there are some services that we're going to bring to your attention. And one of them is the brief communication technology based service, or they call it the virtual check-in or the e-visit, that Medicare now has given us for 2019. And this is one of the new services. And so I'm going to explain to you what this is, because the question that came in is basically, Terry, we got a call from our physician that said, are we billing the new telephone visit that we can bill now to Medicare? Well, it's not really a telephone visit, okay? So let's kind of talk about what that is. So starting January 1st of this year, a doctor or nurse practitioner or PA who is able to bill for E&M services may report this time-based code for what they call interprofessional communication technology-based services. So it's interesting because it's a HCPCS code, which means it's Medicare only. You might find a couple of private payers that might cover it, but the code is G2012. So the descriptor is brief communication technology based service, virtual check-in, by a physician or other qualified healthcare professional who can report evaluation and management services provided to an established patient, remember only established, not originating from a related E&M service provided within the previous 7 days, nor leading to an E&M service or procedure within the next 24 hours or soonest available appointment, 5 to 10 minutes of medical discussion. So these services are limited to established patients, and you're looking at somewhere around, what are they giving us for this? Non-facility payment rate of about $14.78. So it's not a lot of money. It's, you're probably going to charge $25 for it. And then the allowable, again, for the non-facility, meaning you're in your office, is $14.78. There's a facility rate of $13.33, but I wouldn't use this in the hospital setting. I mean, it's there, but I wouldn't. So here's an example of when you can actually use this service. And remember, there are some global issues around it, meaning that you can't have seen the patient within the last 7 days. And you can't then say, based on this communication with them, that you're going to tell them, okay, well, go ahead and make an appointment with my staff because they need a follow-up appointment. So if you do that, then these are not for you. So it would be appropriate to report, let's say G2012. Let's say the patient comes to the office because they fell and hurt their left knee during a soccer game. Then about 10 days after the visit, they notice a faint rash on their right ear. They take a few pictures on their cell phone and send them to the physician through the practice's secure patient portal. So they're an established patient. The doctor looks at the pictures, calls the patient back the next day within 24 hours, and after a brief, 5-10 minute conversation, the physician decides the patient doesn't need to come in unless the rash gets worse or if she develops a fever. And then now the doctor could reply via the portal or a secure email or text message exchange, and you can bill the G2012 code. Now, another example would be those patients. Let's say that you have patients that you're monitoring for blood pressure, and those patients are, there's a patient that hasn't been in for, let's say, a month or two, but they're patients that come in, a couple times a year, they're doing fine. But you have a patient that calls and they talk to the nurse practitioner and they say, I've had a couple of home readouts that are high and I'm concerned, but I don't want to come in for an appointment. And the nurse practitioner, after asking a few questions and talking to the patient, they decide to modify their medication, or the physician. And basically they say, okay, so you don't need to come in unless you have a couple more readings within the next week or two that are high, then you need to come in. So if that's the case, then you could actually, again, bill that G2012. Now, once the patient comes in, then if you've already billed it, then you're going to have to send a refund. Because if the patient comes in within that time frame or the next available appointment, which doesn't have a time frame, then you aren't qualifying for the service. So you want to use this for patients that, there's no, it's basically, that's why it's only worth about $15, because it's just in lieu of coming in for a visit. But the nice thing about these codes is that Medicare puts restrictions on other telehealth services that are subject to rules that say that the patient has to live in a particular type of geographical area, or they have to go to originating site, such as a physician office or hospital, or there are rules as far as being in one of the depressed metropolitan areas. But this is a good step forward for Medicare, understanding that sometimes a patient just needs to make a quick call. One of the things I recommended for one urology practice, actually family practice as well, sometimes you have patients that they just know when a urinary tract infection is coming, and so their primary care physician knows them. They've been seen for years, and then they haven't been seen in the office for a couple months, but they know it's coming. And so the patient calls the practice, speaks to a mid-level provider or the physician, and says, hey, last time I was there a few months back, I had a UTI. You prescribed me an antibiotic and it went away. I've tried the cranberry pills. I've tried cranberry juice. I've tried the other things that we tried before we went into antibiotic. Can you please just prescribe that for me? And, and I can be on my way. So if the provider says, yeah, sure. And just if it doesn't work in the next week or two, let us know and we'll get you an appointment. And that's well documented. Then this is a perfect example of that G2012. But if the doctor says, yes, we'll go ahead and give you the prescription, follow up with me at a next available appointment, this code is not for you. So that's very important to understand. But what our webinar will cover is not only all the other vast telemedicine health rules and codes that you can code for, but there were also some new codes that range from 99446 to 99452 that are interprofessional telephone, internet, and electronic health record referral service codes that we want to bring to you. But that's going to be on a paid webinar. And so if you're interested in any of that, please look at my website at terryfletcher.net, and we're more than happy to get you signed up for those. So those are next week. And telehealth is not something that you can basically say we don't do. It's coming and everybody's out there. And if you want to be competitive in the market and make sure that your office is one that and your practice offers something that other practices do as well. And remember those patient satisfaction surveys I keep talking about. You're going to want to embrace some of these services. So we hope you join us and see what's out there for you. Okay, so a little bit of a personal note here. I was thinking about today, what could I tell you a little bit more about myself? One of the things I like to do, and I know some of us have really gotten away from it, I like to journal, and I like to just talk about my day and write it down, and not on a computer, not on my phone, not through texting. I actually journal, and it's longhand, and it's just a time for reflection. I usually do it at night or early in the morning, and it's just a way for me to longhand write something out of what I am thinking. And boy, I was reading past journals. I've kept them for about 10 years and I started doing it about 10 years ago, and it's just so therapeutic. But boy, what a reality show I could have. Just some of the things I'm like, oh yeah, that happened. Oh wow, that happened too. But if you get a chance, just, get yourself a journal, a blank page, just a book that just has blank pages in it, and just write in it. And it doesn't have to be anything specific. It's kind of like a diary, and keep it at your nightstand. And at nighttime, just write in it, and I think you'll enjoy it. So that's just a little bit about me, and I just always try to come up with some of these fun things. So hopefully you appreciate that. So everyone, make it a great day. And next week we will have our Top 10 Tuesday. I've got lots of coding questions to go over with you, and hopefully you'll find them interesting. So go out and make it a great day, and thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1, or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.